going to rest the foot on the shoulder, cup just superior to the patella, and then bring the femur into extension. You want to make sure that the hips remain nice and stacked. Remember, the psoas has 3 actions at the hip. Hey everyone, thanks for tuning in. Steven here with Team Euphoric, and today I'm going to be demonstrating a general lower body PNF stretching routine. A few weeks ago I had uploaded a similar video, only in that video I was teaching you how exactly to administer PNF stretching, and it was for a general lower body treatment. If you haven't seen that video, I'm going to include a link right up over here, but if you do have a patient or if you have a client that has a little bit of tightness in their lower body, this is going to be a great general routine that you can take them through. This is also going to be really good for anybody that has any type of low back pain, because if you recall from earlier videos, the reason that a lot of people have low back pain is due to some type of dysfunction in the lumbopelvifemoral complex. That is where the lumbar spine meets the ilium meets the femur. If you need a little bit more information on that, I actually did another video. It was called 10 Years of Sciatica Gone, where I go into much more detail about the anatomy, about why exactly people get back pain. If you haven't seen it, I'm going to include a link right up over here. But this video, I'm going to take you through a quick 15 to 20 minute treatment in real time. So if you have a patient or if you have a client that you would like to work with, you can go ahead and follow along to this video. The very first thing that I want to do is I am going to assess and I'm going to do some stretching on the abductors of the hip. So what I'm going to do for the abductors of the hip is I want to bring the patient so that their legs are away from the table. The reason I'm bringing them away from the table is because in order to get into the abductors of the hip, it's going to be a lot easier if I anchor it onto my pelvis and then just walk outward. So right now, we are working on the right abductors of the hip. In order to do the abductors of the hip, you want to take them into adduction. Once you feel a little bit of restriction, what you're going to do is give a couple little taps, and that's going to indicate the patient to push into your hip. So she's going to inhale for 6 seconds, push into my hip, and then once 6 seconds has passed, she's going to exhale and relax. And then I'm going to go deeper into the stretch. With each of these, I'm going to go over it 3 passes. So now we're going to do the second pass. She's going to inhale and push. And then she's going to exhale and relax. And then I'm going to take her deeper into the stretch. One thing worth noting is these are all submaximal contractions. So you're not trying to put as much effort as possible. Inhale and push. You want to give about 20% effort when it comes to the lower body PNF stretching. And then exhale and relax. When it comes to the lower body, generally what I like to do is the abductors back to back. So I'll do the right and left leg. And then once I get on to the full treatment, then I will focus on one leg at a time. Before the abductors, we're going to do both abductors at the same time. When we're doing the abductors, we're pretty much stretching inhale, push. We are going to be working on the tensor fasciae lati muscle. We're going to be doing the gluteus medius muscle, exhale, relax. And then once we get deeper into the stretch, we're also going to be targeting the oblique muscle, so both the internal and external oblique, and also things like the quadratus lumborum. Inhale, push. And exhale, relax. When you're performing the abductors of the hip, another thing worth noting, inhale, push, is you want to have the contralateral leg resting on the shoulder. By doing that, you're able to stabilize the ilium, and exhale, relax. And it's just going to make it a lot more comfortable for the patient. Now that we've done the abductors of the hip, the next thing I'm going to do is place the non-working limb underneath the straps. This is going to help stabilize the non-working limb. We'll get a little bit higher up. There's a strap that you're missing. Yep. If you do have some stretching straps or stabilization straps, you want to get the knee in between the 2 sets of straps, and this is going to help to stabilize the limb and get for a better stretch. But now that we've done that, we want to work on the extensors of the hip. To work on the extensors of the hip, we are going to bring the hip into flexion. So you want to bring the hip into as much flexion until you notice some restriction. Once you cannot go any farther, then you're going to give a couple taps. She's going to push into my shoulder. After 6 seconds has passed, she's going to exhale, relax. And then I'm going to start to move into abduction. The more I go into abduction, inhale, push, the more it's going to target the medial fibers of the glute. And exhale, relax. And again, inhale, push. And exhale, relax. Now from this position right over here, we can go right into the adductors of the hip. With regard to the adductors, you can do horizontal adduction and you could also do longitudinal adduction. So the first thing I'm going to do is I'm going to apply a downward pressure to the knee, and I'm going to have Kat inhale and push her knee up to the sky. So right now she's doing horizontal adduction. She's going to exhale, relax, and I'm going to sink deeper toward the floor. Now from here, what I'm going to do is I'm going to shift my hips forward, and she is going to push her foot into my hip. By doing this, she's now doing longitudinal adduction. And now she's going to exhale and relax, and I'm going to push down to the floor and go a little bit more into abduction. And now I'm going to have her do a combination of the two movements. So she's going to push her knee up to the sky and push her foot up into my hip. Then she's going to exhale, relax, and I'm going to push down to the floor and get a little bit deeper into abduction. Now from here, we want to do abduction on the opposite side. So what I'm going to do is I'm going to anchor her foot onto my ilium, and then using my forearm, I'm going to apply a downward pressure on the fibula. From here, I'm going to give her a couple taps. She's going to give me a little bit of a push with the knee. Yes, you're going to push into my forearm. After 6 seconds has passed, she's going to exhale, relax, and then I'm going to take the leg a little bit more into adduction. So now that we're going into adduction, we're going to be working more on the lateral fibers of the extensors of the hip. She's going to inhale, push, and exhale, relax. And then I'm going to take her a little bit more into adduction. And one more time, she's going to inhale, push, and then exhale, relax. Now the next thing we're going to do is we want to get into the rotation of the hip. So for the rotation of the hip, there's a couple ways that we could do this one. The first, I'm going to anchor my hip against her hip, and then her knee, I'm going to anchor it against my chest. I'm then going to bring her femur into internal rotation. By bringing it into internal rotation, we are going to be stretching the external rotator. So she's going to inhale and push her ankle into my hands. Then she's going to exhale and relax, and I am going to take her more into internal rotation. We're going to give it another pass. She's going to inhale, push, and then exhale, relax. And now one more time. She's going to inhale, push the ankle into me, and exhale, relax. Now from here, we want to do the external rotators, or the internal rotators. So I'm going to take her into external rotation to stretch the internal rotators. I'm going to stabilize at the knee, and then this is going to be my moving arm. So now she is going to inhale and push the ankle into my hands. And exhale, relax. And again, she's going to inhale and push. And exhale, relax. And now one more time, she's going to inhale and push, and then exhale, relax. Next, we are going to move into the extensors of the hip and the flexors of the knee. So what we are going to do is take the hip into flexion and the knee into extension. You want to make sure that the knee remains nice and straight. So this right over here, we are targeting the semitendinosus, which is the most middle of the hamstring group. She's going to inhale, and she's going to give me a little bit of a push with her foot, so push your foot down into me. And then exhale, relax. And I'm going to take her deeper into the stretch. Now from here, what I'm going to do is I'm going to start to bring her femur into abduction. As I bring it into abduction, we're going to target more the medial fibers of the hamstring group, which is going to be the semimembranosus. So she's going to inhale, push, and exhale, relax. And once again, we're going to take her more into abduction. So again, she's going to inhale and push, and then exhale, relax. Then if you have somebody who is very large, if you have somebody who's 300-400 pounds, it can be very tiring on your arm. So what you can do is use your body for leverage. So I'm going to place her ankle on my actual shoulder, and then she's going to inhale and push into me. And then exhale, relax. And I'm going to take her more into abduction by having her ankle rest on my forearm. She's going to inhale, push. ground, so put it right up against my hip. Then she's going to inhale, push. And exhale, relax. One thing worth noting with all of these hamstring stretches is the closer you get toward the ground, generally that is where the person is going to be tightest. So right now we're going to be focusing on the biceps femoris, which is the most lateral. So for this one right over here, we want the foot close to the ground, and this is where a lot of people are going to be really tight. So if you do have somebody with tight hamstrings, you want to be careful in this position right over here. She's going to push into my hip, and exhale, relax. And then from here, just to target a different fiber, we are going to slightly elevate the foot. She's going to inhale and push once again. And exhale, relax. And again, inhale, push. Exhale, relax. And we're going to do one more pass. Get a little bit more body leverage by placing your elbow on the table. Inhale, push. And exhale, relax. Next, we are going to move on to the knee and the ankle. So we are going to be doing the gastrocnemius. For the gastrocnemius, there's a couple different ways we could do this. For Kat, since she's a smaller patient, you could do it with your hands. So you could just cup the base of the heel. I'm going to stabilize just distal to the patella, and I'm going to bring her foot into dorsiflexion. Once her foot's in dorsiflexion, she's going to push on the gas. So push your foot into me.
Down.
Go into plantar flexion, yeah. And exhale, relax, and we're going to go deeper into the stretch. This would be ideal for a more smaller patient. If you have somebody who's very large, let's say you're working with someone who's 300-400 pounds or very muscular, this can get very tiring on your hands. So what you can do in that case is anchor your hand on the heel and then use your body for leverage. So I'm going to bring her into dorsiflexion, and then she's going to push her foot into me. And she's going to exhale and relax. And then one more time. She's going to go into plantar flexion. And then exhale and relax. And I'm going to pull the heel down and bring her into dorsiflexion. That's for the gastrocnemius. Next, we are going to do the anterior tibialis and the rest of the dorsiflexors. To do the dorsiflexors, we want to bring the foot into plantar flexion. So I'm going to just bring her foot down toward the ground, and she is going to try to point her toes toward her head. So bring her ankle up, and then exhale, relax. As with the other ones, we can do different fiber directions. So I can medially rotate the ankle and press down. This is going to target the lateral fibers. She's going to lift up to the sky and relax. And then the last one, I'm going to laterally rotate, and this is going to target the medial fibers. She's going to lift up to the sky and then relax. And that is it for the stretching in supine position. Next, she's going to turn onto her side, and we're going to start to do the rest of the stretching in side lying. So you're going to turn onto your right side, keeping your leg underneath the straps. To make the patient feel a little bit more comfortable and stable, we are going to bend the bottom leg. Now what we're going to do from this position over here is we're going to target the psoas. For the psoas, you're going to just relax your leg. I am going to bring Kat's hip into extension, and she is going to bring her knee forward. The psoas has several actions at the hip. It does flexion of the hip and relax. So we're bringing it into extension. It also does adduction of the hip, so we're going to bring her into abduction. And now you're going to press your knee down to the floor and relax. We're going to take it into extension and more abduction. And it also does external rotation. So we are going to bring the leg into medial rotation by standing up a little bit and bringing the ankle above the knee. Now you're going to press your ankle down into my shoulder and relax. Then from here, we're going to go into extension, abduction, and medial rotation. And she's going to do all three of those actions at the same time. So inhale, bring your knee forward, push your knee down to the floor at the same time, and push your ankle down into my shoulder, all simultaneously. And relax. And then you're going to go into extension, abduction, and medial rotation. From this position, we are going to target the hip flexors and the knee extensors, specifically the rectus femoris. So you want to maintain the hip extension, and I am just going to slowly bring her foot toward her butt until I notice some restriction. Once you get a little bit of restriction, you're going to stop right over there, and she's going to give me a nice kick. Yeah, just push your foot into my hip. Perfect. And exhale, relax. And again, she's going to inhale, give me a push. And exhale, relax. Now one final pass. She's going to inhale, push. And exhale, relax. And her foot's touching her butt, so we can't really go any farther than this. So from this position right over here, we are now done in the sideline position. We are going to go into a prone position. So Kat is going to turn onto her stomach. And from this position, we are going to work on the rotators of the hip. So for the rotators of the hip, the first thing that we want to do is we are going to focus on the lateral rotators. So things like the piriformis. To focus on the lateral rotators, you're going to take your hand, stabilize the sacrum by applying a downward pressure, and then we are going to take her into medial rotation. So bring the foot away from the midline. Then she's going to inhale, bring her ankle toward the inside, so push into my hands. And exhale, relax. And again, inhale, push. And exhale, relax. And one more time. And relax. From here, we're going to bring the leg back to neutral, and to target a slightly different fiber direction, we're going to bring the femur into abduction, and we're going to do the exact same thing. So we're going to stabilize at the hip, bring the leg into medial rotation, and then she is going to inhale and push the ankle into my hands. And exhale, relax. And again. And relax. And one more time. And relax. And now we're going to move the leg one final time. So bring it into a neutral position. We're going to take the leg out. And once again, go into medial rotation. The more you go into medial rotation, the more restricted they're going to be. So you're not going to be able to get quite as deep on each pass. Inhale, push. Exhale, relax. Inhale, push. Exhale, relax. And one more time. Inhale, push. And exhale, relax. Once we've done all three passes, we're then going to bring the leg back into a neutral position. Now we're going to work on the quadriceps. So for the quadriceps, we're going to bring the foot toward the butt. And Kat does not need this stretch, but if she was tight, we would do 3 passes. So she would give a little kick. So push into my hand. Keep your knee down to the floor. Yeah. And relax. And we would do 2 more passes if this was something that they needed. Inhale, push. Exhale, relax. And one more time. And relax. And that is it for prone position. Now she is going to turn onto her back, and she's going to keep her leg under the strap. So turn onto your back. We're going to do one more for the rotators of the hip. For this one over here, it is essentially the Patrick's test / Faber test / figure 4 test. I covered this in another video. I'll put a link right up over here, but this is a general hip assessment. You could also use it as a test. So you're going to stabilize at the pelvis. and then apply a downward pressure at the knee. She's going to inhale, bring her knee up to the sky, and exhale, relax. If this position is a little bit uncomfortable in terms of your body positioning, you can also switch your hands because this is going to be a lot more comfortable. So from here, she's going to, same thing, inhale, knee up to the sky, and then exhale, relax. And one more time, she's going to inhale, knee up to the sky, and exhale, relax. And that covers it for the left leg. Next thing that we're going to do is she's going to switch legs. So now she's going to take her right leg out, put the left leg underneath the straps, and I'm going to have her come down so that the knee is right in between the two sets of straps. And we're going to do the exact same thing. So the first thing is going to be the extensors of the hip. In order to stretch the extensors, we are going to take her into flexion of the hip. She's going to inhale and push, and exhale, relax. Then we're going to take her into abduction to target more the medial fibers in the extensions of the hip. Inhale, push, and exhale, relax. Go a little bit more into abduction. Inhale, push, and exhale, relax. Then from here, we're in perfect position to get into the adductors. If you recall, we have horizontal adduction, and then we have longitudinal adduction. So for the horizontal, she is going to inhale, push her knee up to the sky, then exhale, relax, and I'm going to bring her knee down toward the floor. To do longitudinal adduction, she is going to push her foot into my hip. Then she's going to exhale, relax. I'm going to push her thigh down to the floor and take her more into abduction of the hip. And now she's going to do a combination movement. So she's going to inhale, push up with the knee, and push into my hip with her foot. She's going to exhale and relax. I'm going to push down toward the floor and move her more into abduction of the hip. Now we are going to do a little bit more of the extensors, but this time we are going to take her a little bit into adduction. So I'm going to place her foot on my ilium to stabilize her leg. And using my forearm, I'm going to apply a downward pressure at her leg. She's going to inhale and push. And exhale, relax. Then I'm going to take her a little bit more into adduction. Inhale, push. And exhale, relax. And then one more time, a little bit more into adduction. She's going to inhale, push. And exhale, relax. Next, we are going to move on to the rotators of the hip. So we're going to flex the femur to 90 degrees. Going to stabilize the hip by placing my trochanter against her trochanter. Her knee is going to be resting against my chest, and then I'm just going to rotate my body away from her. And from here, she's just going to inhale and push her ankle toward the midline. So she's going to push into my hands. And exhale, relax. And again. And relax. And one more time. And relax. Next, we just did the medial rotator, so now, or the lateral rotators, now we're going to do the medial rotator. So I'm going to stabilize the knee. She's going to push her ankle away from my hand. And relax. And again, she's going to internally rotate the femur by pushing the ankle into my hands. And then she's going to exhale, relax, and I'm going to take her into external rotation. So I'm pulling at the foot and I'm pushing at the knee. One more time, inhale, push. Exhale, relax. I'm going to pull the foot and push the knee. Next, we are going to move on to the extensors of the hip and the flexors of the knee. So we are going to target the semitendinosus first by going straight toward the midline. So we're going to go straight up and down. She's going to inhale, push her foot into me. And exhale, relax. Next, if we want to start to target the semimembranosus, we're going to bring the leg into abduction a little bit. She's going to inhale, push. And then exhale, relax. To make it a little bit more comfortable, if you have somebody who's very large, you just rest their limb on your shoulder. Inhale, push. Exhale, relax. And then we're going to slowly start to move the limb down toward the floor. So again, she's going to inhale and push. And exhale, relax. I'm going to do a couple more passes. Inhale, push. Exhale, relax. And we're going to do one final pass before we move on to the biceps femoris. Inhale, push. And exhale, relax. Now we're going to do the exact same thing, only this time we're going to start to bring the leg more into adduction to target more the biceps femoris. So I'm just going to bring the ankle across the midline. She's going to inhale, push her foot into my hand. And exhale, relax. Go a little bit more into adduction by bringing the foot closer to the floor. Inhale, push. Exhale, relax. And again, inhale, push. Exhale, relax. Inhale, push. Exhale, relax. And then we're going to do one final pass, bringing the foot nice and low to the ground. Inhale, push. And exhale, relax. From here, we're going to do the knee flexors and the plantar flexors. So we are going to get a hold of the foot. Again, two ways that you could do this. One is to stabilize just proximal to the ankle. We're going to bring the foot into dorsiflexion. She's going to push on the gas and relax. Then if we want to make it a little bit easier, if we're working with a large client, we're going to use our body as leverage. So we're going to pull on the heel and use the shoulder to push the patient into dorsiflexion. Inhale, push. Exhale, relax. And one more time, she's going to inhale, push. And exhale, relax. And that is it for the supine position. Next, she is going to turn onto her left side. So we're going to start to do a little bit of work in sideline position. In sideline position, first thing we're going to do is target the psoas, so some of the hip flexors. With regard to the psoas, again, we are going to rest the foot on the shoulder, cup just superior to the patella, and then bring the femur into extension. You want to make sure that the hips remain nice and stacked. Remember, the psoas has three actions at the hip, so one of them is flexion, so we're going to bring the hip into extension, and cat is going to flex the hip by bringing the knee forward. And relax. It also does adduction, so we're going to bring the leg into abduction by getting a little bit taller. She's going to bring her knee down to the floor. And relax. Get a little bit taller. Then it also does external rotation, so we're going to go into internal rotation by bringing the ankle above the knee. And push your ankle down into my shoulder. And relax. And now we're going to do a combination of all three movements. So bring your knee forward, push your knee down to the floor, and push your ankle down into my shoulder. And relax. We're going to go into extension, abduction, internal rotation. From here, we're going to target the hip flexors and the knee extensors, so the rectus femoris. Stabilize at the iliac crest. Bring the knee into the hip into extension, and we're going to start to flex the knee until we notice some restriction. Once we get a little bit of restriction, we're going to stop. She's going to inhale, push the foot into my hip. So give me a little kick, yeah. And exhale, relax. And again, inhale and give me a kick. And exhale, relax. And one more time, inhale, kick. And exhale, relax. From this position, if you wanted to, you could also do the abductors of the hip. So you could target the TFL just by bringing the leg down, but I'm not going to bother doing that because we already did that at the very beginning. But that's it for the sideline. Next, she's going to lie down onto her stomach, and we are going to focus on the rotators of the hip and the extensors of the knee. So for the rotators, again, what we want to do is apply a downward pressure at the sacrum to stabilize the pelvis, and we're going to bring the femur into medial rotation. And this is going to stretch the lateral rotators, specifically the piriformis. Inhale, push your ankle into my hands. And exhale, relax. And again, inhale, push. And exhale, relax. One more time. And relax. From here, we're going to bring the foot into neutral. We're going to bring the femur into abduction a little bit, and we're going to do the same thing. 3 more passes in this position. Inhale, push. Exhale, relax. Inhale, push. Exhale, relax. Inhale, push. Exhale, relax. Now we're going to do one final pass by bringing the leg a little bit more into abduction. Same thing, stabilize the pelvis. Inhale, push. Exhale, relax. Inhale, push. Exhale, relax. One more time, inhale, push. Exhale, relax. And now we're going to do the quads. So we're going to bring it back into neutral. We're going to stretch the extensors of the knee by bringing the knee into flexion. So we're going to bring the foot toward the butt. If they were unable to touch, we would do 3 passes. So she's going to inhale, push into me. So give me a kick. And exhale, relax. And inhale, push. Exhale, relax. And one more time, inhale, push. Exhale, relax. That's it for prone position. She's going to get onto her back once again, and since we just did the lateral rotators of the hip, we want to do the internal rotators. So for the internal rotators, again, we can do the Faber test. So we're going to place the ankle over the knee. Again, 2 different positions. You could do it this way. This might be a little bit uncomfortable, or you can just, whatever hip you are working it, that's going to be the hand that's on the knee. So inhale, knee up to the sky, and exhale, relax. Inhale, push. Exhale, relax. One more time, inhale, push up. Exhale, relax. Now we are going to bring the foot into a neutral position. Kat is going to remove her leg from underneath the straps. And we are going to do one final pass on the abductors of the hip. going to give a little bit of a push. And exhale, relax. Inhale, push. Exhale, relax. And one more time, inhale, push. Exhale, relax. Now we're going to do the other side. Again, the reason that the limb is on the opposite shoulder is to help stabilize the pelvis, because otherwise they're going to roll over. Inhale, push. Exhale, relax. Inhale, push. Exhale, relax. And one more time. And relax. And now if we want to target the lumbar spine, what we can do is get them really close to the edge of the table, flex the knees toward the hip. You're going to rest their feet on your chest, and then just press the feet into the chest. So you want to bring their knees as close as possible to their chest. So you want to lift the sacrum off the ground, and now what Kat's going to do is you want to try and bring your sacrum down toward the ground, so extend your hips. And exhale, relax. And again, inhale, push. And exhale, relax. Inhale, push. Exhale, relax. But if we want to target some other fibers in the back, what we're going to do is cross the leg over. So we're going to maintain this leg in a nice straight position. This leg is going to be crossed over. And we're going to do the exact same thing now. So I'm just going to bring the hip into extension. And this is going to target a little bit more the lateral fibers in the lumbar spine. And Kat is going to inhale and try and bring her right hip down toward the table. And relax. And again. And relax. And one more time. And relax. Now we're going to switch legs. So we're going to get the right leg in a neutral position, cross the left leg over the right. Let's cross that right over, perfect. And we're going to do the exact same thing. So right now we're targeting the lateral aspect of the lumbar spine on the left side. Inhale, push. Exhale, relax. Inhale, push. Exhale, relax. Inhale, push. And exhale, relax. So this right over here is really good for the lower lumbar spine. And then if we wanted to target a little bit more superior, what we could do is have Kat extend her arms out. So I'm just going to grab a hold of both of her arms, and I'm just going to give her a little bit of a pull. So you're going to kind of assist me a little bit by doing a crunch. And this is going to help to stretch out a little bit higher up. And from this position, we could just reset everything by doing a couple little movements back and forth, mobilize the hips a little bit. And now Kat is going to turn onto her stomach. And now that we've created all that space in the lumbar spine, the pelvis, and the femur, what we want to do is we're going to have Kat to solidify all that space that we just created. She's going to do 10 body weight squats, and that is going to help to stabilize the pelvis. So you're just going to stand right over there and just do 10 body weight squats. If you just perform this PNF stretching routine and you have them get right up off the table, then everything's going to still feel pretty loose. So just going to have her do 10 body weight squats, and this is just going to help to solidify the space that we just created. But That's pretty much it for today's video. If you do have any patients that have any type of low back pain, or if they just have general tightness in their lumbar spine, this would be a terrific routine that you could do with them at the end of a training session or as a standalone treatment. But that's pretty much it for today's video. If you enjoyed the video, be sure to smash that like button so I know to make more of these types of videos in the future. And if you're either new to the channel or haven't subscribed yet, be sure to subscribe to the channel and hit the notification bell, as I will be uploading new videos every single day. That's it for today's video. Thanks for tuning in, and I will see you again tomorrow.